Medical workers are preparing for the coronavirus surge to get even worse from the holidays. CBS 2's Joy Benedict is live this morning in Long Beach, where a historic hospital is reopening to help the area's overwhelmed health system. Joy, good morning to you.
Good morning, DeMarco. That's right. I mean, it couldn't come any faster, right? It is a much needed boost to this community as they are looking for any bed possible, and they're going to get a few, or at least a few dozen out here in Long Beach. We are live this morning. This is the old historic community hospital of Long Beach, and it is set to reopen today for the first time in a couple of years. The hospital itself actually opened back in 1924, but closed a couple of years ago. Starting today, it will have 11 intensive care unit beds and space for 40 other patients who do not have the coronavirus. The hospital itself shut down in the summer of 2018 when its former operator thought a seismic retrofit would be too costly. The city got involved, and the new operators have now spent more than $6 million modernizing the nearly 100-year-old building. And now the California Department of Public Health has granted them a license to reopen today. It is a small but mighty boost to area hospitals that are certainly filling up fast. And this morning, the LA County's Emergency Medical Services Agency is clarifying a memo that has begun to circulate on social media. Now, the directive was regarding heart attack and stroke patients. Instead of whisking a patient to the hospital right away, the policy stated the patient should be resuscitated at the scene first, have a pulse for at least 5 minutes before taking them to the hospital. The county says that has actually always been the policy, that they were just reiterating what that policy was and those recommendations. That is not a new policy. They just want to make sure that the patient is stable enough for travel. But meanwhile, those working inside the hospital are continuing to report a lack of resources to help those in need, as doctors fear the number of positive cases will continue to soar.
This is the worst medical disaster that I've seen in over 30 years of practicing in emergency medicine. Many of our staff have gotten sick with COVID. And so we are finding ourselves on some days not having enough staff, and particularly, like I said, those highly trained ICU nurses and physicians. We could find ourselves at a point where we have to ration care.
And I know all these numbers are just very overwhelming for many people, even me, and I hear them each and every day. But we did sort of reach a very grim milestone over the weekend, and that is 800,000 positive COVID cases here in Los Angeles County. That is enormous, and it's even bigger when you think of the fact that there were only 400,000 positive COVID cases about a month ago. That just tells you how fast these cases are increasing here in the area.